So when we look at the practicality of the Flibanserin, the Addy, you take it every day, right? It's not an episodic drug. You take it every day. But the other one, I don't always say that correctly, Vyleesi, I think is how you pronounce that.
Bermelanotide is the generic.
Bermelanotide, yeah. And it's an injection that you'd inject in your thigh or stomach 45 minutes before anticipated activity, which is then meant to have the same kind of neurotransmitter effects, but increase the dopamine and increase your desire for that sexual encounter. But obviously takes some planning then, right? So I don't know what kind of experience you've had with that one.
I don't use that one as much. Number one, you've got needles. Number two, you have to inject yourself with a needle. And I haven't seen as great of insurance coverage for it. I don't think it's out there as much. So I don't tend to use it as much. I use testosterone way more than I use the injectable. Because I think testosterone helps with a lot of wellness domains. And if you can just get a woman feeling better in general, you're going to help her sex life. So again, I don't tend to use the injectable as much. It's an interesting story, though, just for fun and giggles on a podcast. It works on the melanocortin receptors. Melanocortin also responsible for darkening of skin and skin pigmentation. So a side effect can be skin pigmentation. They were studying this drug as a sunless tanning product. Somebody involved in the company gave themselves a double dose and they had an erection for a day. And they said, maybe there's something here in the role of sexual function. I just love drug discovery stories. They're the best.
That's amazing. I didn't know that story. Yeah. So the data would show that it's similar to the Flibanserin and that it's pretty, when you look at the satisfying sexual encounters is, I think, 0.5 instead of 1 in a month. So it's a little less. But yet again, to our point before, if that's something that's important to you and it works for you, then that amount it's not for us to judge. But I do see the difficulty with this when you're having to take it 45 minutes before, you're being planful, you're having to make that decision. And oftentimes for women, it's difficult to make that decision and push yourself into that point if you really have no desire. How am I pushing myself forward? Once the engine starts warming up, sometimes it's a lot easier, right, to keep going. But it's getting that initial push over and having to give yourself an injection, and I think would be a little bit more of a difficult situation.
The other tricky thing with that med is the rate of nausea. At least in the beginning, they say it does wear off with repeated use, but the rate, so some people will prescribe ondansetron with it because being nauseous is definitely not sexy. So it's a significant risk of nausea. So again, I don't use it much, so I haven't really done that, but just for people to know, you're going to get that side effect with that drug, but not with the Flibanserin.